So putting it all together, I've mentioned this a couple times, but I really think patient selection is key for this. It's oftentimes a very large operation. It can last, you know, 10, 12, 14, 16 hours sometimes, be if there's a lot of disease and we're stripping off, the peritoneal surfaces, kind of imagine kind of trying to strip off all the wallpaper from the walls of your house. And so it's a large operation, and I think being medically fit is important to be able to tolerate that. I've mentioned a couple times, ability to remove all visible tumors and still, leave behind, the organs that are essential for functioning, obviously. One of the common reasons we can't do it is because all of the small bowel is kind of involved. And if we were to remove all of the small bowel, then it's impossible to get nutrients or eat. And it's just too much to be able to do. And so the disease burden has to be at a level where we can kind of physically remove it all. And then we're oftentimes thinking about what is the biology of this cancer, what's the prognosis. So that's what I mean when I say what kind of cancer. Is it that low grade appendiceal, not growing fast kind of cancer? Did it show a response to chemotherapy? We generally think of those as having good prognosis. And so overall, with all of that, I think what I'm trying to kind of describe or mention is that we're really balancing the risks of potentially removing multiple organs and a long surgery, sometimes a long hospital stay, and just a big recovery after a big physiologic insult and impact on really the quality and the length of life. And if you're in the hospital for 3 months, but we only increase survival by a month or two, I think maybe that's not the best option, because there's a lot of that we want to maximize the quality of life as long as prolonging in the length of life. And so it's a really complex decision making that I think, at least in our experience, we try not to make in a vacuum. We make it in a multidisciplinary discussion and on an individualized basis. But those are some of the reasons that someone might be a good candidate, or maybe there are other options that are better for them with respect to Hipec treatment.